This is Catherine St. Louis, New York Times reporter. I'm here today at Riverfront Pediatric Dentistry in Elmwood, New Jersey. This is Dr. Eyal Simchi.
Hello.
We're here today to talk about a new way to kind of deal with cavities that just got FDA clearance relatively recently. It's been used abroad, and I think in Japan it's been used for like 8 decades.
Yes, over 8 years.
But Dr. Eyal is one of the early adopters, so we're here to kind of see and hear a little bit more about silver diamine fluoride. What's silver diamine fluoride? Give me the breakdown.
Silver diamine fluoride is basically a medical treatment of decay versus typically what we used to do, which was the surgical treatment. So instead of drilling and filling, we're trying to stop the process a few steps beforehand.
Awesome. So drilling and filling, drilling, before I was an oral health reporter, I didn't really know that that really meant that you were taking away the decay.
Yes,
but of course, before the drilling, you give a shot, which there's no kid on the planet that likes. Not even adults like it.
True.
So part of when you use SDF, you don't have to, there's no injection.
No injections, no drilling, no filling, typically. It's basically just a medication that's placed on the tooth to affect the decay process and stop the process.
Got it. So basically it stops cavity in its tracks.
Pretty much, yes. It arrests the decay.
Yeah. So talk to me a little bit about how careful you have to be to just place the liquid just on where you see the decay.
So SDF is not very dangerous. According to studies, there's I think a 400-fold safety index, so it's not dangerous to get anywhere. It just stains anything that it touches typically. So
stains?
Yeah, so that's the reason that we really need to keep it where it is just because we don't want it to stain areas. It will stain.
Got it. And what color is a cavity usually? Like when you're looking in a patient's mouth, what color is a cavity? Is it like a
it really
tan
can range. It can range from brown to green to sometimes even red. It really depends on foods that people are eating and also the bacteria that are causing the decay. But usually it's a brownish color.
Interesting. So after you apply the SDF, how long does it kind of take to darken?
Sometimes you see the effect immediately. You can actually see it start to darken on the spot. On the brushes that we usually you see it. By the time you throw it out, it's already darkened. But it's also an effect of light on the silver fluoride. But usually we have patients come back about 2 to 3 weeks after the first application, and by the time they come back, it's already darkened.
Got it. So let's first talk about some of the advantages of silver diamine fluoride. It's kind of a new paradigm in the sense that drilling and filling, I think a lot of parents and adults who have gotten fillings sort of think that that solved the problem.
Yes.
But what's actually the truth?
So drilling is really solving the effect of what the problem is. So it's really just removing the decayed tooth once that process already happened. The silver fluoride is affecting it at a stage beforehand. It's trying to stop the process at the source, because the cavity itself is not the problem. It's the end result of the problem, which is the infection of decay.
Yeah,
so
I think most people don't realize that cavities are like an infectious disease.
Yes.
And that's why as a parent, if like your child has a pacifier and it happens to fall on the ground when you're at the park, you should never ever put it in your mouth and quote clean it with your own saliva, because my saliva probably has cavity-causing bacteria, and I'm just passing that on to my kid.
So there are multiple studies that show that transmission of the bacteria typically is from the main caregiver, which is usually the parent, to the child. So if you have cavities, or if you've had cavities and you have bacteria that can cause cavities, that can easily be transmitted to the kid through a pacifier, sharing toothbrushes, spoons, biting food, stuff like that.
Fascinating. So if you guys have any questions out there for Dr. Eyal Simchi about cavities or how they're caused or how to prevent them, or this new treatment, silver diamine fluoride, let us know.
We did have a question.
Oh, hold on.
Glenn asked, wasn't fluoride supposed to fix this? What's the difference?
So fluoride is one part of the process. Fluoride helps remineralize tooth, so it helps make the teeth less susceptible to the acid that's causing the cavity from the bacteria, but it's not as effective. And actually, some studies are showing that silver diamine fluoride is more effective than what we typically use as the gold standard now, which is fluoride varnish.
More effective, just so I'm clear, more effective at stopping the cavity.
At preventing and arresting decay.
Right. And before, when we were doing fluoride varnish, what was that doing? What's the distinction?
So the main focus of fluoride is to remineralize areas. So it helps strengthen the structure of the tooth. And to a small degree, it also helps cut down the bacteria count, because it does have an effect on the bacteria, but not close to as much as the silver in the silver diamine fluoride has.
Fascinating.
So silver diamine fluoride incorporates another process to it, which is the bacteria killing process.
Right.
So that helps kind of cut down the bacteria load, which reduces the risk again.
Interesting, interesting. So it seems like the pro is that it's actually a medical treatment for cavities, while we have kind of been dealing with a surgical treatment for cavities.
Correct.
What are some of the other upsides? Like when you're talking to parents about silver diamine fluoride, how do you explain the advantages? Well, then we'll get to the downside.
Got it. So there aren't that many downsides. Almost all of it is upside. There's a lot less treatment going on at the same time. The procedure, which I guess we'll show afterwards, is a very quick and easy, painless procedure. There's no trauma.
Actually,
there's no drilling.
Let's show now the. So you put the silver diamine fluoride in a little dish.
So basically, we have a little dish over
Okay.
here. It's just one drop of the material. Just
Let's do it. So 1 drop of silver diamine fluoride, how many teeth, like if I have 5 or 6 cavities with decay, how many teeth can that one little drop of silver diamine fluoride treat?
It can probably treat all 5 of those. The
Wow.
FDA approval was for 5 sources in the mouth, so that's usually what we use it up to 5 places in the mouth or 5 different teeth. They can always come back for another appointment and have more done, but
So
generally
just
this
in
little
terms of-
drop can really get a lot of work done.
So give me a sense of how much you pay for this entire bottle of Advantage Arrest. I guess it's about 8 milliliters. How much does that
I
cost?
don't know the exact price,
Yeah,
but it's
like
under
120.
something like that. I think it's
Yeah.
under $200 for sure.
I think that's kind of mind-blowing because many of us who have had cavities, certainly myself, even with dental insurance, I pay probably like $150, $200 after for each tooth I get drilled and filled. And you're telling me an entire bottle of this is $120 about. So maybe this could potentially be more cost-effective for patients.
So it definitely can be, and I know a lot of the health services and areas where they're underserved areas use silver diamine fluoride
Yeah.
a lot. We use it as one of the tools of the many tools.
Exactly.
Dentistry in general is very expensive. It's just
Yeah.
even going to the dental office because the overhead is so high for
Of course.
everything. But it's definitely something that can help. I mean, you know,
Yeah.
it's less than half the price of a filling typically. It really depends on the office that you go to.
Got it.
But
Okay, but let's talk about the downside because it's not all upside. And the downside is something that dentists have kind of been debating this year where silver diamine fluoride has really been a hot topic at dental conferences.
Right.
Whether or not parents are going to be okay with their kids' teeth darkening. I think like in the back, I have a ton of amalgam fillings.
Right.
Like, and nobody's looking in my mouth. And
definitely
seeing all
doesn't
that silver.
look worse than amalgam. So
Right.
if it does anything, it's really just affecting the decayed part of the tooth. So if you have a small cavity, you may not even see the stain,
Right.
or maybe just in one little area of the groove. Versus
Right.
a bigger cavity, you'll see more of it, but it's not as bad as the silver
Well,
stain
let's
for sure.
actually show viewers a little bit of this, what it looks like before and after. So on the left side is decay on let me show, why don't you point to the decay?
This tooth over here, there's decay. That's tooth number F,
Yep.
and that's decay in between
And
the teeth.
then the other side is after the application of silver diamine fluoride. So you can see that darker. So keep in mind, as you'll recall from childhood, your baby teeth don't stick around forever. So there's actually a lot of people who say, oh, baby teeth don't need to be treated. They're just going to fall out anyway. But there's a
Right.
strong incentive to treat baby teeth.
Definitely.
And that's because the mouth that you have and the cavities you have at 5 are a predictor of what you might have later in life, right?
Yes, definitely.
So what's neat about SDF is that it can treat the infection and find it might blacken a little bit of this kid's front tooth, just a little spot.
Cases like this also can be masked afterwards because you can fill over silver diamine fluoride. And some
Okay.
material companies are actually making more opaque filling
Interesting.
materials to kind of cover that effect.
Interesting. But even so, I wonder whether or not you do find that there are some parents who don't mind having a child having just a little dot that's extra dark. If they can avoid injections, they can avoid drilling and filling, and then the kid's tooth's going to fall out in 10 months anyway.
So definitely there are parents that are fine with it. Not all of them. For back teeth, I haven't had any parents complain that they
Yeah.
were upset about any color. For the front teeth, depends on the parent,
Right.
depends on the kid.
Right.
Some are okay with the color, some aren't as okay with the color, but
Right,
you know,
and of
there's-
course, you don't have adults in your practice. For adults, it's a whole different equation because they're not going to lose their teeth.
Right. So I do use it on older patients and teenagers for back teeth,
Okay.
especially on partially erupted teeth that are
Okay.
not fully in the mouth, where it's really tough to successfully drill and fill if you
Okay.
have to, and that can actually buy you time and stop the process, which is another advantage of
Right,
it.
because in between teeth cavities, those are actually quite hard to get at, right?
Yes, so that you have to reach with floss.
Right. No, what I mean to say is that don't you have to drill through healthy teeth to get to the side where the decay is and then in between cavities?
Occasionally.
Sometimes?
It really depends on where the decay is. If the decay isn't accessible except through healthy teeth, then yeah, you have to go through a healthy tooth structure to get to it.
So I've heard that some dentists are using silver diamine fluoride on a little bit of floss and then flossing it in the in-between area to sort of see whether or not that could be useful in arresting that.
That's what we do here.
cavity.
Yes, we use.
That's what you do.
Yeah,
here.
it's a floss that's a little absorbent, and it absorbs some of the material into it, and we floss that through.
Wonderful. So let's talk for a second about reapplication, because it's not like you can just apply silver diamine fluoride once and you're done.
Right.
Talk to me about how often you have to reapply.
So it's new enough that there aren't any. I mean, there's now that official protocol from California. There aren't a lot of protocols. Most people are using it once and then having patients come back 2 to 3 weeks later and doing a second time, and then.
Just so.
Sure.
At that second appointment, 2 to 3 weeks later, what are you kind of looking for? It's both a hardening and a blackening, right?
Yeah, so you're going to see a difference. Typically, you even feel the difference already in the tooth structure. So if you have a part of the tooth that was soft beforehand, a lot of times it's a lot less soft the next time they come in.
And soft, just for the viewers who don't realize, that's the decayed
That's the
part,
decayed
right?
part of the tooth, yes. So
and that's what you would have taken away if you had chosen to drill and fill. That's
correct.
the decay you take away and then put a hard filling to restore tooth structure.
Yeah.
Let's go to another question.
Yeah, Kelly on Facebook asks, can you talk about the financial incentives or lack thereof for dentists to do this treatment?
So it's a good question. I try not to take financial part of it into my decision-making process for my patients, but it can work out either way because it takes a lot less time, so it's a lot less chair time. The material itself is not very expensive because you're not dealing with a lot of patient management because it's such an easy, quick appointment.
And by patient management, you mean being a super nice, kind adult who pretends they're not just about to inject your kid's gum.
Correct. Hopefully our patients don't know that we do that. So, but yeah, it takes a lot less time. So even though you're not getting paid as much, now again, I don't know what other offices are charging. Here we charge about half the price of a filling, but it is much faster also. So even though they're coming multiple times, it probably just works out equal.
And talk to me about why you got into dentistry. It sounds like in the beginning you had a dentist who maybe made you a little afraid of the dentist, and then that's how you went into this profession.
I went to a general dentist. I didn't get a pediatric dentist when I was a kid, so he was a nice guy, but I didn't have a great experience. I have a tough gag reflex, so I don't like any of that stuff. Even now I have a tough time going to the dentist, so I know what it's like, and I know what my patients are like going through, so I try to make it a little easier.
And how is silver diamine fluoride in terms of that anxious patient? Is there sort of a difference if you can kind of tell a kid there's not going to be an injection, it's just going to be...
It's great to show them what it is because they can see we can wipe this little brush that doesn't have much on it onto their finger. They can see that that's all it is. We sometimes show them a mirror so they can watch us apply it to the tooth. There's really nothing very noisy, nothing that's changing sensations in their mouth at all. It's just a brush with a material on it onto the tooth. So it's really, really not invasive. Little kids may have a tough time opening their mouth anyway, but even if they do, it's really, really quickly. It's a couple of minutes of work versus more time for fillings. In terms of our older patients, I've had patients that have a really tough time at dentists, and this can also buy us time. And if they have a tooth that has a big cavity...
Let's talk a little bit about that because we haven't yet. There are plenty of preschoolers, 2 to 5 year olds, I think the CDC number is that nearly a quarter of 2 to 5 year olds have untreated cavities. And some kids that young have a ton of cavities, a mouthful of cavities. And you really can't have a 3-year-old sit in the chair and be patient for you for hours while you drill 8 cavities. So usually those kids actually end up in an operating room under general anesthesia having their teeth restored. As you can imagine, that's quite costly. And also, there are parents who have concerns about general anesthesia because we don't know yet what the effects are on the developing brain, although we don't know yet that there's a huge problem, but it is being studied. So plenty of dentists I interviewed sort of talked about silver diamine fluoride as a way of stalling that visit to the OR and getting general anesthesia for a later date. Let's talk a little bit about that.
So it helps in different circumstances. Sometimes offices are just really booked out in terms of getting to the OR in time, so that can help. Silver diamine fluoride's effect originally, when it was going through all the process of getting FDA approved, was for sensitivity in teeth. So it can help with kids who are having sensitivity because of those cavities already. So that's just buying you time to get to the operating room. There are cases where I've actually used it as buying you time to not go to the operating room. So if we could actually stop the process enough to get the kid a few years to be old enough to be able to treat in the chair, we're able to actually then restore, if possible. So.
Right. And how do parents react when you say, I know maybe your older kid, we took him or her to the OR at 4, but with your younger kid, now that we have another option with silver diamine fluoride, if you don't mind the teeth are going to have a blackened spot at that point of decay, we might be able to drill and fill and just wait for age 7.
Right. So most parents are very relieved by that. Generally, parents don't want to put their kids under general anesthesia if they don't have to. You know, sometimes we're stuck in circumstances where if there's an active infection that we have to deal with, and we still have to. But with silver diamine fluoride, there's much less OR cases for me at least.
Yeah. Interesting. So, how long have you been using it?
I've been using it since the end of 2015, so probably about 8 months or so.
So it's still relatively new. It's really a lot of just early adopters so far. So parents shouldn't hesitate to sort of ask their dentist about it.
Definitely.
I think it sounds like we have another question.
Yeah, Dan on Facebook wondered how available is this around the country? And if you could also give a recap for people who just joined.
Oh, hi. Okay. It's Catherine St. Louis from the New York Times. We're talking about an alternative to drilling and filling cavities. We're here at Riverfront Pediatric Dentistry in Elmwood Park, New Jersey, with Dr. Eyal Simchi. We're talking about SDF, or silver diamine fluoride, which is actually a liquid that you can place directly on decay, very carefully, to stop cavities in their tracks. Many people might not know, but cavities are actually an infection. And this is kind of like the antibacterial liquid that you put on to just medically stop that infection.
And can someone go to any pediatric dentist in America and they'll have this?
So it's a pretty new product, and in dentistry, lots of times dentists are a little weary of new products until it's been tried for a while. There are new filling materials that are out that a lot of people won't use until it's been out for multiple years. So it really depends on the office that you go to. Any office can purchase it. It's just really up to the dentist to make a decision if they're comfortable using it or not.
And the thing is that really doctors are finding out about it at dental conferences, on Facebook pages where dentists share cases and really talk about it, about its uses. So it's sort of fanning out. What's interesting is there is a study coming out soon that shows that it is being taken up by pediatric residency programs.
Right, that I've seen.
So we are kind of building it into the next generation of dentists.
Yeah.
But this generation of dentists really has to find out about it at a dental conference or through
Dental
other
Town,
dentists.
websites,
Or
and stuff
dental,
like that.
right.
Website.
Facebook pages like Dental Town. The other thing to mention is it's actually FDA cleared for tooth sensitivity, just like fluoride varnish.
Correct.
Neither of these have clearance for actually how we're using it. But that kind of off-label use, we do a ton in medicine. So it's not terribly surprising that we do off-label uses in dentistry too.
Correct.
Can we look at the pictures once more?
Yeah.
I just wanted to know what the side effects are.
Oh, well, let's look at the pictures again, and Dr. Eyal will point to where the decay is in the picture that isn't treated.
Here's the non-treated decay, and this is what it looks like once it's treated.
So the downside, as you were telling me, Eyal, is that it does darken that kind of tannish or brownish decay to a little blacker. But what other downsides are there? I mean, I think I read about some gum irritation and a few.
It can be irritating. Sometimes people put Vaseline on the gums beforehand. We use cotton rolls to isolate it, and typically you're using such a small amount that it's really not dripping around. It's not getting throughout the entire mouth, but it can irritate the gums also.
Okay.
So far, I haven't seen that yet.
Okay. And really, the upside is you're halting the infection instead of simply drilling and filling and dealing with the effect.
So even in cases where I do fill the teeth, where I feel like the cavity is big enough that we have to drill and fill, in many cases I'll put silver fluoride under it and then rinse that out so that we're at least killing the bacteria that's under the filling, which may or may not help the fillings last longer. Well, I guess we'll see from studies if that works. But
well, that's a great point, because here's the thing. It's not like silver diamine fluoride can work for every cavity. Like if a tooth structure is deteriorated enough that you really have a hole, how good is it going to be to put silver diamine fluoride there? Is everyday food's getting caught in it? If the tooth structure is really impaired.
So it won't fill the hole, but it will at least stabilize the hole. So in cases, especially for younger kids where you're just unable to drill a lot, or you know, the only way you'll be able to drill is to put them on general anesthesia. With the silver diamine fluoride, there's a lot less drilling even if you have to drill. So you can place the silver diamine fluoride, have them come back in a couple of weeks. Most of that decayed tooth will be already stained by it, and you can see the differences already.
Stained and hardened.
And hardened. You can feel the texture is different, and then drilling-wise, you don't have to take away as much tooth because the underlying tooth that's a little stronger, you can then fill on top.
So let's talk about some news that all parents are going to want, which is how can I reduce my kid's cavity risk? What am I doing wrong that my kid still has cavities?
Not for sure doing anything wrong. There are lots of factors that come into causing cavities. There's many factors. Some you can do something about, and some you can't. So the main ones that you can do something about are number 1, diet. 2 is brushing and flossing, and 3 is fluoride use. So those are really the things that you can affect.
So one thing I find fascinating is one way to reduce your cavity risk is actually just to reduce snacking. So instead of just going to the park and snacking on those Trader Joe crackers for a window of time, if you just sit your 3-year-old down and say, hey, we're going to have a snack for the next 10 minutes, then that means their teeth are only bathing in acid for that 10 minutes.
Correct.
Rather than the letting your kids snack on that buffet for 2 hours at the playground.
Right. The more time that they only have saliva in the mouth, which is very protective for their teeth, the better. So even while they're eating, their acid levels will spike because of the bacteria breaking down the food. If they stop eating for a long period of time, those levels will go back down, the saliva will neutralize the acids, and then the tooth structure will remain intact. So the kids that are frequently snacking, they never get to that neutral point because they just keeping those levels higher and higher.
So it's not that it's what you're eating. It's any carbohydrate.
Definitely also what you're eating, but it's not only what you're eating. It's what you're eating and how you're eating it.
Yeah, that's fascinating. What are some of the other ways that could maybe reduce cavity risk? I mean, it sounds like reduce snackings. What
Brushing is really important because you're physically removing the bacteria and you're removing the food which feeds the bacteria.
We should say brushing with a fluoride toothpaste.
Correct.
Because there are a lot of folks who are trying to brush with a non-fluoride toothpaste.
Right. So a lot of people are nervous about fluoride, but most of fluoride's effect, it seems in all the studies, are topical. So even if they're not swallowing any of the fluoride, as long as they're brushing with it, it will help strengthen the teeth.
And we should be brushing with fluoride how early in a kid's life?
So it really depends on where you live. If there's fluoride in the water, you want to push it off a little bit. Guidelines are changing a little bit because some areas don't know how much fluoride is in the water. So typically until about 2 to 3, we usually recommend either no toothpaste or a training toothpaste. And then as they get older, we incorporate a little bit more, starting with about the size of a grain of rice and then moving to pea-sized as they get older.
Wonderful. Thank you so much for your time.
You're welcome.
I'm really excited.
Hopefully I answered some questions.
Yeah, thanks. So ask your dentist about silver diamine fluoride the next time your kid has a cavity.